So I wanted to share with you my experience having a septorhinoplasty procedure done, specifically a septorhinoplasty with turbinate reduction and nasal valve repair. So backstory, I was having difficulty breathing out of my nose. I had severe obstructions in both nasal passages, and air just wasn't getting up there as it should, as effortlessly as it should. It's really difficult. I was getting stuffed up all the time. And that just, it led to me having a lot of anxiety because I felt like I couldn't breathe. And actually, I currently do take medications for anxiety because I do deal with that, and I actually thought that septoplasty would solve the issue of anxiety, but it didn't. So if you're thinking that it might, like I did, I'm here to tell you that it doesn't, but it does help ease anxiety somewhat, but it's by no means a cure. Okay, so as that was an aside. So because of the difficulty breathing, I ended up going to my ENT. He said that I had a deviated septum, about 70% blockage here and about 40 here. And so he said that he highly recommended the septoplasty surgery. And so I thought about it, and of course, insurance covers the septoplasty. So I got on some good insurance and basically was good to go for the septoplasty portion. But he also is a facial plastic surgeon. So I ended up getting a septorhinoplasty. So the septoplasty, of course, was going to be the functionality correction, and the rhinoplasty was going to serve as the cosmetic portion. So I told myself that I wasn't going to be going under the knife twice in my life, and I probably was never going to adjust my nose in the future just because surgery is not that appealing. So I figured it's now or never. So I got the rhinoplasty portion done as well, just to refine and enhance the nose. But my nose was always a point of insecurity for me, so it was actually a great opportunity for me to just feel a little bit better about it, and I definitely do. So I highly recommend rhinoplasty, especially septorhinoplasty, because you kind of get the best of both worlds. At least that's what it feels like. So I just want to share with you a few tips that I used to just help me through the septorhinoplasty surgery recovery. So first things first, you're going to need this guy right here. You're going to need a back pillow, because let me tell you, you cannot sleep at a 180. You just can't, because that actually aggravates the swelling, and it can increase and prolong the swelling recovery time, and that's just not what you want. Okay, so you either have to sleep, 90 degree angle, 45. So that's actually pretty tough. It was tough for me because I'm just not used to sleeping like that, because we normally don't sleep like that. But definitely helpful to have. You adjust after like the first 2 nights, so it won't be that bad. Secondly, you're going to need a good neck pillow. I would say, firm, or the ones with the little beads inside. That's what I use. They both work well, just as long as you have a neck pillow, because it just helps stabilize your neck area, and it just helps you from moving around so much. So that really helps, because any slight movement, it actually makes it feel pretty dizzy and nauseous and queasy. So you can't really stand up abruptly at all. And when you do start walking, at least in my experience, I became dizzy and I became nauseous, and I just did not want to be standing up or walking because it just didn't make me feel good. So I spent most of my recovery time sitting down on the bed. So that's another thing. Be sure you have a comfy bed that you can recover on. The main recovery is the first week. That's the real kicker, is that first week, where you have to just be really hypervigilant on every little thing that you do. So another thing that really helped me was having a vaporizer right by my bed. You can either get a vaporizer or a humidifier, but the whole thing is that you want to keep moisture in the room because that helps with just getting that blood going and running and all that, the liquid secretions coming out, which is what you want, and also the nuisance of a dry mouth. Okay, so dry mouth, you will experience that. What I used was ACT Now dry mouth tablets. You can also use Biotine. I found that the Biotine spray didn't actually do the trick for me. It actually left this filmy, gooey residue on the surface of my tongue that just wasn't a pleasant feeling. So I did away with the Biotine and I just switched to just the ACT Now dry mouth tablets, and that really, really did it for me. Another thing that is extremely helpful to have is just ice cubes. Ice cubes really helped with that dry mouth. Okay, so using the dry mouth tablets and ice cubes, you won't have any dry mouth problems. The only thing is you have to be sure to be using them pretty consistently, because you'll definitely notice when the dry mouth starts coming back, because you'll just feel it and it's extremely hard to swallow and all of that. So, and also having very, very, very soft food is what you're going to want to eat, because you can't really move your mouth. It's really hard to smile. It's really hard to move your jaw and just chew. So you don't want to put in any solids, because unfortunately chances are extremely high that you're going to end up choking, and we don't want that. Okay, so my older sister was kind enough to prepare adult baby food. So she calls it adult puree. And so it was basically it was a texture of baby food. And it was just so easy to swallow. Didn't have to chew, just and swallow, and that was it. And she made a lot of good flavors. She made savory flavors and fruity flavors. And here's another interesting fact. You cannot taste at all. Like your taste buds are all of a sudden they're dysfunctional. You cannot taste. So they're like out just slumbering, and it's just really freaky. You can't taste, and it just kind of teaches you a life lesson too. Just be thankful for having the sensory receptors to be able to taste food, because food just, it tastes good. Of course, when it's good food and all that, but you get what I'm saying. So that was interesting. I think it's very helpful, of course, to have entertainment, because you are going to be sitting down on that bed for what seems like 24 hours, give and take. So you will be the epitome of a couch potato, okay? You will be a human couch potato. So you're going to have to embrace that. And there's no shame in that, okay? It's pretty fun, actually, especially for people who are always, extremely busy bees. It's just nice to just sit down for a while and catch up on all those Netflix shows that everyone's raving about, and you never understand the references because you just don't get the jokes because you don't watch the series. Anyway, something super helpful, of course, is your medication. Now, let me tell you, I received codeine with acetaminophen, super, super strong painkiller. It did the trick, okay? But let me tell you, when the codeine started to wear off and it was time for me to take another tablet, I could feel the pain. And let me tell you, on a scale of 1 to 10, goodness gracious, it was a 10, okay? It was off the charts. Extremely painful. I don't know what it feels like to give birth, but I'd say it was pretty high up there. So I could be wrong on that, but okay, I'll experience that one day. So yeah, very painful. So just be sure to just really be charting the times that you take the medication. That's what my family and I did. Very, very helpful because you're able to look at the chart and see exactly the time that you took the tablet, and then you're just able to take the tablet every 6 hours as instructed, or every 4, and just what the medication bottle says. So just keep tabs, because nothing's worse than saying, oh, did I take the codeine 6 hours ago, or was it 3? You don't want to overdose on that thing. Okay, so some homeopathic medications that I think really, really worked. Two of them. One is called arnica and the other is called bromelain. Okay, so I actually took these 2 homeopathic medications a week before my surgery. And I have to tell you that I really think they contributed to my minimal bruising and swelling post-op. I had seen other videos of girls that underwent septal rhinoplasty, and they were extremely swollen post-op. I'm not sure if they had taken the arnica before. I never saw them say that they did. So I would say, if you want minimal bruising and swelling, take arnica and bromelain. You won't regret it. Okay, and your face will thank you. So yes. Okay, so I didn't look like I had 2 black eyes, so that was really interesting. I thought that I was going to look like a professional boxer, but I didn't get that look after all. So, okay. I think something else that you should be aware of is, do not get the arnica gel, because that actually burned the surface layer of my skin off. Not very pleasant. Right here in my cheek area, my forehead area, the skin literally peeled off where I had actually applied the gel. So might want to steer clear from that gel and just stick to the arnica mouth tablets. You just put it some sublingually and they just melt away, and it's very straightforward. So another thing to be aware of is that I had said earlier that you really can't move your mouth. So chewing is difficult. Like I said, you can't smile. So be sure to tell your fam to not be funny. Tell them to be as boring as possible. If they're already boring, then you have no problem. So I know my family is extremely funny, even when they're not trying to be. And so it was really difficult, because I would just my initial reaction was just to start smiling, and it would be painful. I would regret it. So yeah, just talk to your facial muscles here and say no smiling. So yeah, you should be good on that one. The recovery of the first week seemed to take an eternity to pass by, but nonetheless it did pass by. And one thing I didn't mention was that you have to be replacing the gauze, which is catching all of that liquid that's draining out of your nose. Preferably have a family member help you redress that gauze, because it's very hard to do it yourself. Okay, and there's a little technique to it too, so be sure to ask your doctor how exactly to apply the gauze. And so, because that needs to be changed pretty regularly, daily. So that's one thing. So I actually got my surgery done on August 2nd. I'm pretty much at the 3-month post-op, almost 4-month post-op. And I just want to tell you a little bit about what my nose has felt like throughout that time. Well, I will say that I got my cast off at the end of the first week. So mine was kind of like a rush job because I had to go to school. But that aside, normally it's 2 weeks. But yeah, I did mine in 1 week. So basically the cast was taken off and I had a giant scab. I had splints in. So when the splints were taken out. I know most people say that's the most painful part. It wasn't painful for me whatsoever because my physician numbed my entire nose with lidocaine on the inside. And it was just kind of like a funky, slightly uncomfortable feeling. Nothing to be worried about, at least in my case. Just ask your surgeon, please numb the inside of my nose and you should be good. So that was interesting. The big reveal, of course, to see how the nose looked, and that was fun. Kind of frightening too because the nose was extremely swollen. It actually looked like the human couch potato like went to my nose, and now my nose is a potato. And so don't let the grand reveal shock you too much, because just know that the majority of what you're seeing is just swelling. So yeah, your nose will be swollen, so just be patient with your nose. I'm still trying to be patient with mine. So then I was off to school, and the thing is, I just had to keep putting petroleum jelly because I had a big old scab there. I could not pick at it at all. You can't pick your nose at all. You can't pull the dissolvable stitches out. You can't. You just have to let them dissolve, let them fall out as they please on their own time. You can't rush Mother Nature. Okay, so the scab too is very just annoying to have under the nose. It's like an eyesore. People like, how did she get a scab under her nose? I'm just like, please, don't look at me. Don't look at the scab. But it's not even that bad at all. But you can't go putting a Band-Aid on it or anything because the scab needs to breathe. That's the only way it'll fall off. Okay, so aside from that, I also had to keep putting nasal saline spray, which was also part of the 1 week recovery as well. I didn't mention that. Very, very important to keep your nose very moist. And even with that packing in there, you still have to keep the nostrils, even just the entrance, nice and moist, because that helps with loosening up that dried blood, because you will have a lot of dry blood. So that brings me to the next point. There was a lot of dry blood for the very first month of recovery. Just blood would just seep out. Sometimes I would be telling myself, oh my goodness, geez, are you sure that everything's okay up there? Because I felt like I would just have random nosebleeds. Just like, what's going on? But it's just part of the recovery. My doctor said everything was fine. That's just part of it. So you will probably experience that. And so I actually stopped taking the arnica after the 2 week mark because my physician said that it doesn't really make a difference after that. So yeah, I stopped the arnica. The bruising was still very, very, very apparent at the end of the 1 month mark. Even at the 2 month mark, very apparent, very swollen. What's interesting about this is that one day you'll wake up and the nose will look thinner, and then the next day you wake up and it'll look puffier. That's because you have to be very, very, very aware of your sodium intake. The more salt that you eat, the more swelling that happens, okay? So just try, I'm not saying just cut salt out of your diet at all, but just try to minimize it, sorry. So today the nose is still very swollen, but it's definitely come a long way. So I just want to take a moment just to show you the front view, the quarter. Okay, so that's how the nose looks right now. A lot of progress, but still a long ways to go until I reach that 1 year mark, when I finally get to see how the nose will pretty much look for, from now on. So I hope I kind of helped you out on what to expect for just the recovery of a septal rhinoplasty. Before surgery, just mentally prepare. Just tell yourself, I'm really going to get this done. It's very expensive, so it's not a decision that you should make prematurely. Make sure that you've thought about it, that you've thought about the pros and cons, and just about what it would do to you mentally to actually change the centerpiece of your face up, and also the functionality. Like, you want to add to the quality of your life, and I think opening up your nasal passages will. And I just want to say that when I breathe in, the air actually feels cold. It goes all the way up. Now I could breathe. Now I'm getting oxygen to my brain, and I need that. So it's been a real game changer for me. And I just know that the benefits are going to keep increasing as my nose continues to heal, because on the inside, it still is very much swollen and very tender, sensitive. So still have a way to go, but I'm content at the mark that I'm at right now, and I'm looking forward to the rest of the journey. So if you have any questions, comment below, or just let me know your thoughts. Thank you. Goodbye.